All right, diabetes. So diabetes, there's an increased prevalence of diabetes in the country and in the world. So we will be seeing more and more of these in the primary care setting. So you can kind of tell there's different types of bleeding. It gets progressively worse. And so we'll kind of go through some of them. So as you can tell, normal vessels, you have the macula, you have the optic nerve, you have two veins are the darker vessels, and the arteries are the lighter color vessels. And you can kind of see normal ones, they look really healthy, really clean. People with bleeding, diabetes, they can cause pretty much two types of bleeding. One is non-proliferative diabetic retinopathy, and the other one is proliferative, meaning there's just more of them, and new vessels are growing. So abnormal vessels, and you can kind of tell there's different severity as you go on. All right, so retinal damage caused by diabetes. So what happens during diabetes is that the sugar increases in our body. Insulin is produced by our pancreas. So there's two types of diabetes. One is type 1 diabetes. They're usually really congenital, where the pancreas doesn't produce insulin at all. And these patients are typically diagnosed pretty early on. They can be diagnosed in their 20s or 30s, however. Actually, I just had my cousin diagnosed with that. But with these patients, type 1, they usually are on insulin. So if they're on insulin, it can kind of tell you whether they're really severe type 2 diabetes or they're actually just type 1 diabetes. And once you're on insulin, you really can't be off insulin. So that's type 1. Type 2 diabetes is usually developed later on in life. A lot of times it's contributed by poor diet or overweight, and the vessels accumulate to your body is requiring more insulin, but the body doesn't have enough to cover everything. So in terms of the vessels, they causes a lot of stickiness on the vessels of the walls of the vessels. So then the vessels become really, the walls of the vessel become really sticky, and sometimes they can break. They're fragile, so they break. And then that's where we see bleeding in the body. Because the eyes are the only area that you can actually see active blood vessels, you would have to go through an MRI, kind of a scan to look at vessels. So the eye exams are actually really important because we can actually tell how the patients are controlling their diabetes. In terms of from the heart to the brain, there's different branches of the vessels. The first branch that goes off from the heart to the brain is the eye, the vessels that go into the eye, so the ophthalmic artery. And so a lot of times, we see more conditions in the eye before it gets to the brain. And so diabetes is also one of them. So the two types, we talked about that. Once the blood vessels kind of break, they can be ugly, they can break all over, or they can kind of have microbleeds. Kind of, if you bruise yourself, you can get big bruises or a little bruising. So risk factors, one of the things is, definitely diet, poor control of your blood sugar. Some people are more genetic, depending on dietary, depending on the food that you really eat. High starch, high sugar can cause this. And usually we ask in the exam room their A1C. Hemoglobin A1C basically is a number that they look at in the last 3 months, 90-day period of your average blood sugar. And that gives us an idea ranging anywhere from like a 4.0 to like 20 or more, Most people, healthy range is around 5. That's healthy. If they're diabetic, we usually like to see around 6. If they're 12 or 13, then it tells us that they're not controlling their blood sugar very well. High blood pressure, diabetes can affect blood pressure. Blood pressure can affect their kidneys. So usually people who are not controlling their diabetes very well, they'll also be on high blood pressure medication. So usually you'll see those two together. And one of the things they want to do is to protect their kidneys from kidney failure. High cholesterol can also affect the walls of the vessels. And sometimes cholesterol, we can see it being affected in the eye, especially with these branches in the eye. These cholesterol basically are little, what we call embolism. They can get lodged, or lipid. They're just protein and fat. They kind of get stuck between the two vessels. And so sometimes that can cause kind of like those twisty type balloon. If it gets stuck, then the pressure in these vessels will increase and they can burst. And so in some cases we see a bursting of the vessels in the eye. Pregnancy can also affect diabetes. There's gestational diabetes that usually result in a larger baby than average, but the mother usually has really high glucose level, sugar level during pregnancy. Tobacco use as well, and then Hispanics, African American, Native American, it's just predominantly more diet, carbs that can increase sugar intake. Non-proliferative diabetic retinopathy, the earliest stage of these tiny, tiny blood vessels that start to break. And usually we don't see them in those big vessels. We only see them in the tiny, tiny vessels, and we have to look carefully. And they can show up on the optos, and we can see them. And usually these tiny vessels do not affect vision. Patients will not notice anything. We will just kind of monitor, and usually we don't need to do anything. We just want to kind of keep an eye out. Sometimes, depending on where these tiny, tiny bleeding are, it can happen near the macula. If it happens near the macula, it's going to affect the macula. Different types, the microaneurysm, we talked about tiny, tiny blood vessels. There are also retinal hemorrhages. They're a little bit bigger that leaks in the retina, and then there's these deposits of cholesterol and other fats in the blood. That's what we call heart exudate. They're just different terminology. The area that can cause leakage, kind of like macular degeneration, is macular edema. So cataract can cause macular edema. Macular degeneration can cause macular edema, and then diabetes can cause macular edema. So there's just a lot of different ways. And then macular ischemia is basically parts of your retina turns white from the lack of oxygen. So if you think about if you push on really hard on your finger, that area of your finger becomes white because there's not a lot of blood flow. So same thing, if all the bleeding are being leaked elsewhere, then the area that's really actually needing the oxygen from the blood vessels will turn white because that's just not getting enough oxygen. And that can cause blurry vision. So proliferative diabetic retinopathy is when their diabetes is a little bit not controlled at all. And usually this will happen if they've had diabetes for a really long time, more than 20 years or so, or if their A1C is just out of control, like 18, 19. And so this happens when there's just more bleeding happening. If the areas in the retina is not getting enough oxygen, just kind of like the cornea as well, and elsewhere in our body, if the nutrients are not getting to the area of the organ or the structure, the body will try to heal itself, and that's kind of the underlining theme. The body, as a way of healing itself, it tries to create new vessels to carry oxygen to that area. But however, these new vessels are not very stable, they're abnormal, and they're really thin. And because how thin they are, they're more likely to bleed. So it's kind of that vicious cycle where new bleeding causes new thin vessels. And so if there's a lot of them, that's what we call proliferative diabetic retinopathy. And because they're sticky and thin, these vessels can stick to the vitreous. And sometimes during that adhesion to the front, the jelly part of the eye, it can actually create bleeding during that traction. Because every time you move, the vitreous kind of moves around, kind of like the snow globe. It kind of moves a little bit. And so if these vessels are really fine, it can cause a pulling, and then you get a hemorrhage, okay? But the hemorrhage is not really localized, it just kind of seeps in front of it. So the vitreous can become all bloody. So then you look inside and it's all bleeding. You can't even see the back because there's just bleeding in the vitreous. That's what we call a vitreous hemorrhage.
Would it make your vision red?
Oh yeah. I mean, yeah, you may see red through it. Yep. And then in certain cases, during that traction, it can actually pull the retina off, and that's what we call tractional detachment because of these vessels. So in vessels, again, if there's a lot of growth of vessels, we can actually see it creeping up, not just in the back, but also in the front. And the angle, remember with glaucoma, the drainage is blocked or so on, it's not getting enough fluid out. A lot of these vessels, these tiny vessels, can creep up into the angle as well. And we can see that in the front of the eye. So it just kind of throughout the body. And this is only in the eye. It can happen in the brain or in elsewhere in your body. A couple ways we can treat it. Let's see here. Oh, how do we test for diabetes? Well, we do annual optos, OCT, we do visual field 10-2 or 24-2, depending on where the bleeding are, where we see it, and then we definitely dilate, take a closer look. So currently there's really no cure. I mean, we can control this situation if we decrease our sugar intake, if we're more healthy, if we're exercising a lot, keeping that A1C down. But if the bleeding is out of control, there's a couple ways where doctors can go and laser the retina to kind of pretty much kill off the peripheral retina so that the bleeding, more oxygen is more localized to the area that's really needed, meaning the optic nerve and the macula. Also, these little laser pretty much destroys pigment and destroys the retina, so then the new vessels are not growing. So it kind of controls that bleeding. There's also these injections, just like macular edema, they inject in the eye to kind of slow down the new growth of the blood vessels. So those are called VEGF, vascular endothelial growth factor. So they'll decrease that. And in those patients who have those bleeding seep into the anterior part in the vitreous, then there's a procedure called vitrectomy, kind of like an oil change of your car. They just suction everything out, and they insert a man-made bubble inside called the vitreous. So everything's kind of replaceable. These patients, the outlook of these, if they've gone through a lot of these laser, they're not going to have a lot of peripheral vision, because they're damaging the retina through these laser, and your body will scar the area where it's been lasered. So what can we do? If they have diabetes, usually we send a report back to the physician during their annual eye exam, communicating, hey, we didn't see anything, or yes, we did see something, and this is how often we want to see these patients back. If their diabetes is really out of control, a lot of times we'll refer them out for surgery. If they're out of control but they're being monitored well, then sometimes we'll see them a little bit less frequent if they're being co-managed by somebody else.
What are common medications that a diabetic like to look out for? Because patients, they're hard. It's hard to be.
You don't know which medication. Yeah. So
what should I look out to think that they're on if they have diabetes?
Yeah. So a couple of things, like definitely insulin. If they're on insulin, they're diabetic. A1 or 2, right?
I ask.
Yeah. But most common, they're on like metformin. They can be on 500 milligrams or 1,000, depending on twice a day, once a day. They can be on glipizide. That's very similar in terms of, decreasing their sugar as well.
Right.
So some things to watch out for, especially also with diabetes, you also want to ask them how often do they go back to their PCP or how often do they see their endocrinologist. Because if they only see typically the routine is they should be seen for routine checkup every 6 months. That usually tells them they're pretty well controlled. If they are seeing them every 3 months or less, then that gives you an idea that their blood sugar is not under control.